Hi, my name is Sarah Moffett, and I am presenting today on discrete child training. In this presentation, we will cover the importance of discrete child training, specifically how it helps children with autism spectrum disorders through early intervention. In describing discrete child training, we will address ABA, other behavioral principles involved in DTT, and the 5 parts to implementing DTT. We will also look at how it handles problem behaviors and other characteristics of children with ASDs, along with training parents and teachers on how to implement the procedure. Suggestions for future research will be addressed, and a brief conclusion to pull together main points will follow. Some of the common characteristics of children with ASDs tend to be a lack of typical learning through modeling, conversation, exploration, or creative play. Due to the deficit in these skills, learning can be significantly difficult for these children, and oftentimes problem behaviors arise during instructional periods. The most common problem behaviors are tantrums and escape behaviors. DTT is designed to help children with autism learn necessary skills and alleviate the frustrations they experience in typical learning environments. Instructions and demands are placed at a faster rate. Errorless teaching is implemented through the use of prompts, and correct responses are reinforced using highly preferred items. One-to-one teaching environments allow children to focus better and without many distractions. Each of these techniques have been proven to reduce the occurrence of problem behaviors during instructional periods. Discrete child training is great for young children diagnosed with autism because it provides a one-to-one teaching environment. Within that environment, the instructional period is very brief, only about 5 to 20 seconds, and the instructions are clearly set for the beginning and the end of the intervals. Skills are worked on one at a time, and more challenging skills are broken down into smaller units and taught using a chaining technique. It is also very helpful with the autistic population because it utilizes a 5-part process that includes an errorless teaching method, which essentially lowers the level of frustration for autistic learners. The 5 parts of DTT include the cue, which is like the SD, or discriminated stimulus. This includes a brief, clear instruction. For example, the teacher would say, "Do this," and perform an action or point to a simple drawing. The prompt can be delivered with the SD or immediately after in order to allow the child to give the correct response. The prompts could be guided, verbal, modeled, or gestural prompts. Prompts need to be faded throughout the trial so the child does not become dependent on the prompts. The response is the correct or incorrect answer given by the child. Last is the consequence, which serves as the reinforcer. These can be social, edible, or tangible reinforcers. The teacher may reinforce approximations to the behavior until the child is able to meet the correct response. The intertrial interval is a brief pause about 1 to 5 seconds before the next trial begins. ABA is most often the treatment of choice for children diagnosed with autism. DTT was designed by Dr. Lovas in utilizing ABA principles. DTT is most effective when combined with other behavioral principles such as reinforcement, shaping, extinction, stimulus control, and training. These principles help instructors of DTT establish and maintain instructional control when problem behaviors or undesired behaviors arise. Many other behavioral principles can be combined to be individualized to the learner. Thorough training is necessary for DTT to be implemented properly and ensure that the child is receiving effective treatment. Studies have shown that as teacher accuracy improves, children's maladaptive behaviors decrease. Parents are becoming partners in their child's education by receiving training on implementing DTT strategies at home. Manuals have been developed for both professionals and parents to use. Self-instructed manuals prove to be efficient and effective to train students to implement DTT strategies with children with ASDs. Research has shown that DTT, when combined with incidental teaching and other interventions, produces more salient results and allows children to utilize the skills learned through DTT. It is suggested to combine errorless teaching with other methods in order to individualize the program for the learner and be most effective. DTT is primarily used in the classroom setting. Research suggests using it in a variety of settings to promote generalization of skills. DTT has proven to be one of the most effective tools for helping children with autism spectrum disorders learn new skills in the area of cognitive, language, and social skills, and reduce undesired behaviors. Thorough training for individuals who will be implementing DTT strategies is essential for effective outcomes and generalization. DTT is built from the principles of applied behavior analysis and combines principles into DTT instruction. Although DTT has extensive empirical data that show its effectiveness, future research suggests further examination on details of DTT like environment and errorless teaching. Thank you for watching. I hope you enjoyed my presentation.